If all women age 40 and older took advantage of early detection mammography plus clinical breast exam, breast cancer death rates would drop by 30%.
Doctor, do older women need to get mammograms?
Yes, they should. The greatest risk factor for getting breast cancer is age, so it becomes doubly important later in life to continue with screening mammography. That is the single greatest risk for breast cancer. And also later in life, slow-growing breast cancers have a time enough to accumulate and be large enough to detect, whereas earlier they may not be seen. Ultrasound technology has improved dramatically in the last few years. However, ultrasound is a very directed technique. It looks at a very small area of the breast, whereas mammography covers the entire breast on each side. So it's important to find initial abnormalities by mammography. Mammography is also much easier to compare from year to year as well. We talk about ultrasound as being like using a pen light in a warehouse to find a box, whereas mammography, you can take a picture of the entire area.
I want to get a mammogram, but I hear that radiation is very dangerous.
Well, that is a very common fear among women. But I would need to tell you that the technology has come so far with our digital imaging that the radiation dose has decreased so much that that is not even a viable concern, honestly, for me. Because the risk of cancer in your age group is actually 1 in 10. So mammography, being the best screening tool that we have to detect cancer early, is the best option.
I'm not likely to get breast cancer. I have no family history.
The most significant risk for breast cancer is being a woman and getting older. About 80% of women diagnosed with breast cancer have no family history.
Can men really get breast cancer?
They indeed do have a small amount of breast tissue, and men can get breast cancer. They can also have extension to local lymph nodes very early. So any mass that is felt in a man needs to be worked up immediately. It's usually nothing serious, but it can be very serious. So it's very important to be aware of that.
I need a mammogram. I haven't had one in a really long time, but I just can't afford it.
Well, you're very fortunate to live in this community. It's a very generous community. We have some programs that are available, as well as state and federally funded programs to which you may be eligible for.
Our annual Moonlight and Mammograms is a wonderful event that is open to the public. It's a festive, informative celebration with your health in mind. Come by, have a drink, some cheeses, and a mammogram while you're there. Call ahead for times and catch the moonlight.
It's our Moonlight Mammogram.
And what does that mean?
It means exactly we're having a celebration. We're doing screening mammograms for patients that either have difficulty coming in during the day, have difficulty coming in when we're not open on the weekends, low-cost exams for women. That's what we're doing.
The physicians, nurses, and the entire staff at the Breast Imaging Center are here for your health and your well-being. We look forward to answering any questions or concerns. Please call for your peace of mind today.